Let's talk about the challenges of utilization management. All right, let's be honest. Utilization management, or UM, sounds like a smart way to make healthcare more efficient. But it's definitely not without its problems. In fact, some of the challenges it brings can get pretty complicated, especially when you're dealing with people's health and money. Challenge 1. Creates tension between patients, doctors, and insurers. One big issue? It can create some serious tension between patients, doctors, and insurance companies. Imagine this. A patient gets a treatment, everything seems fine, until the insurance company refuses to cover it. Now that patient is stuck with a massive bill. And the worst part, they probably had no idea this would happen until after the treatment. You can see how that would feel unfair. Challenge 2. Experimental treatments are hard to approve. Then there's the fact that UM tends to lean toward the most cost-effective and safe options. That sounds great in theory, but what if someone needs a cutting-edge or experimental procedure? Getting approval is time-consuming and often denied, leaving the patient to pay out of pocket. Challenge 3. Extra workload and frustration for clinical staff. Let's talk about the impact on hospital staff. Nurses and providers are trained to care for people, not push paperwork. But with they often have to spend time doing reviews and analysis. That means less time for patient care and more burnout, especially when decisions are delayed in critical situations. Challenge 4. Complex and slow to implement. And implementing in a hospital, not a walk in the park. You're basically reshaping how everything works, from policies and procedures to workflows. It takes time, planning, and a lot of teamwork. Without buy-in from staff, it's hard to implement effectively. Challenge 5. Conflicting goals between hospitals and insurers. Hospitals also have to deal with a tricky dynamic. Insurers are focused on cutting costs, while hospitals are focused on patient care. These are conflicting priorities, and finding a middle ground is often easier said than done. So utilization management has its benefits, but it's packed with challenges that can't be ignored. From strained relationships and administrative headaches to questionable cost-effectiveness, it's clear that any hospital considering needs to go in with eyes wide open.